I'd like to talk about heroin. Heroin is portrayed as the most dangerous of all the illicit drugs. The assertion and commonly held belief is that if too much of the substance is taken, i.e. an overdose, the person may stop breathing and die. This is just not true. There has never been any evidence to even suggest the existence of such a phenomenon. Heroin. Heroin could be considered a prodrug for morphine, meaning it is essentially a delivery system for morphine. Heroin is rapidly metabolized to morphine once in the body. So morphine could be considered heroin's primary active metabolite. Morphine has no maximum dose and no ceiling effect, which is a level at which it ceases to impart a therapeutic effect. The side effects of morphine are nausea and constipation. Importantly, there is no such thing as fatal heroin overdose. It has been unequivocally proven that substantial overdose of heroin does not result in harm. Overdoses of 150 milligrams up to 450 milligrams total dose have been administered intravenously to participants in a clinical study. The study was double-blind and randomised. So-called heroin overdose. What is routinely referred to as heroin overdose is actually profound sedation caused by combinations of depressant drugs. This sedation can lead to airway obstruction and asphyxiation, which is oxygen starvation. This chain of events is when the person is profoundly sedated from a combination of depressant drugs and unable to control their airway. This is not cessation of breathing due to respiratory depression. It is simply a physical restriction or blockage of the flow of air to and from the person's lungs caused by structures in the throat and/or vomit. The combining of depressant drugs can result in profound and dangerous sedation. This sedation can lead to airway obstruction, asphyxiation, and brain injury or death. The myth of fatal heroin overdose is the primary strategy used to create fear about the drug and its use. Heroin is not an inherently dangerous drug. What must be avoided is dangerous combinations of central nervous system depressant drugs, such as those involving alcohol, barbiturates, or benzodiazepines, for example.